Hello, I'm Dr. Greg Malone from Brisbane Urology Clinic. As a urologist, I know that most patients' urological conditions are discovered in your office, not mine. That's why I'd like to become a resource for you. My practice specialises in helping patients improve their quality of life through the very best in medical care and information. The science and practice of urology has made remarkable advances in the last decade. Through this video series, I will share the latest trends in urology and other industry information that may aid in the early diagnosis and treatment of urological conditions in your male patients. The first common urological condition in men that I like to share with you is urinary incontinence, or involuntary bladder leakage. Urinary incontinence is a frustrating and often embarrassing condition defined by the involuntary leakage of urine. The leakage can be the result of a damaged sphincter, the muscle that controls the flow of urine out of the bladder. When the sphincter can't fully close off the urethra, leakage occurs. While this condition is typically associated with women, worldwide over 43 million men suffer from urinary incontinence, either stress, mixed, or urge urinary incontinence. Approximately 10.4 million of those men are suffering from stress urinary incontinence in particular, which is defined as the involuntary leakage upon coughing, sneezing, or some form of exertion. As you know, the proper investigation and diagnosis by a urologist is key for effective treatment. The causes are numerous for stress urinary incontinence, but fortunately, so are the treatment options, which can even include surgery. In men, it can be caused by prostate cancer treatments, pelvic trauma, or surgery and some medical diseases, for example, diabetes, multiple sclerosis, Parkinson's disease, or stroke. As you would know, there are many options for handling urinary incontinence. In the first instance, there are lifestyle modifications and protective undergarments that can help manage incontinence symptoms. In addition to this, there are non-surgical options, for example, external penile clamps and interior and exterior penile catheters. And last but not least, there are surgical options that treat the underlying causes, which include slings for mild to moderate symptoms, artificial urinary sphincters for severe symptoms, along with compression balloons and bulking agents such as collagen injections. A patient's life doesn't have to slow down just because they're experiencing symptoms of bladder leakage. Restoring your patient's confidence, rather than simply managing it, often requires a more substantial treatment. In my practice, one of the most professionally rewarding aspects is when I can achieve for our patients complete continence. That is, to render a man continent of urine. Converting a patient who may be wearing anything from 1 to 4 or more pads per day to a dry and pad-free status is a fantastic outcome. These interventions will dramatically improve that man's quality of life. If you're interested in learning more about urinary incontinence and the surgical treatment options that are available, please feel free to contact me directly. Or look out for my second video where I'll delve into the treatment options for erectile dysfunction available to your patients suffering from this debilitating condition.